Hi, my name is Dr. Nikki Belcher, and I am hoping to share just a brief presentation on workplace mental health. And the reason why I chose to just give a quick presentation on workplace mental health, I have had a couple individuals talk with me about some of the stressors that they're facing in the workplace. And so, as I thought about it, I thought, you know what, I'll do a quick little blurb on workplace mental health. If anybody looking at this presentation has any thoughts or concerns or want to talk further, you'll find my contact information at the end of the presentation. Again, this is just more educational, kind of psychoeducational. Um, just shared a little bit about some of the thoughts around workplace mental health that I think may be beneficial to others. And so, what is workplace mental health? Well, it really refers to the emotional, social, psychological well being of employees in their work environment. And so, it involves everything from managing a healthy relationship with colleagues and managers and supervisors to prioritizing your own self care within the workplace. Um, and so when we think about mental health in the workplace, we think about a lot of things around that, and there are some significant issues that surrounds um, our well-being in the workplace, and so it affects both employees and employers. Again, it's that work-related stress that we are trying to manage in the workplace for various reasons that are hindering our self-care within the workplace. That could be just disgruntled colleagues, a supervisor that you um, don't quite get along with or can't communicate with. It can be a number of factors that, and also outside external factors that come with us to work that cause that work-related stress. And so again, demanding workloads, a lack of support definitely can impact our mental well-being if we feel like we're not being supported in the workplace by colleagues or supervisors or the HR. Definitely, we will feel that. When we are dealing with workplace mental health, there is a high probability that your productivity is not what it should be. So you have that decreased productivity. We find ourselves, or you'll find yourselves calling in to work. So being absent or being late. And then from both standpoints, the employee standpoint and the employer standpoint, there is an increase in healthcare. If you have co-pays and you're finding yourself needing to go to your doctor more, what have you, that's an increased cost in copay. And then also from an employer standpoint, there's an increased cost there as well. And so let's talk a little bit about the key aspects of workplace mental health. And so, when you talk about those key aspects of workplace mental health, there are three components that we talk that that I'm speaking of, and one is the emotional well-being. This just refers to the ability to experience those wide range of emotions from which are wide range from happiness, sadness, fear, anger, but in that space of emotional well-being, one of those that component, we are also is very important in how you manage those emotions. And so another component of mental health is psychological well-being. This encompasses the cognitive processes, the thinking, the memory, the making decisions, but also as well as one's self-esteem, purpose, and meaning in life. And then the third component here that I speak about is just the social well-being. And this really involves healthy relationships, what that looks like, from a family dynamics, culture, and socioeconomic status. And so, once again, I kind of want to this is just a short piece on workplace mental health. And here I talk specifically about the impact on employees. Again, only because I had a couple individuals that that I had talked a little bit about some of the stressors that they were facing in their workplace. And so I thought here I would just highlight the impact on employees. And we talked some about this earlier, reduced productivity. Stress and mental health conditions can make it difficult to concentrate. And when we can't concentrate, we know what happens. We make mistakes, we get burned out. And so then that becomes a problem in the workplace as well. Also talking about being absent from work. You know, it, it, it can cause employees to miss work. Again, that results in what? Lost productivity, which then, and oftentimes if we're working in groups or teams or someone's counting on us, that, you're calling in late or not coming, that increase being absent can cause a potential strain on colleagues. And so um, another impact on employees is when the work environment just does not support your mental health. It definitely can lead to decreased job satisfaction and a sense of isolation. The morale is low there in the workplace, and so that's a definite negative impact. Again, we talked about increased healthcare costs from both employee and employer. And from an employee standpoint, it it leads to that increase in medical expense, loss of wages that may occur from you not feeling supported and having a real difficult time in the workplace. So if you're experiencing, any of the things that we've already talked about in the previous slides, but if you know you, and it's really important to have self-awareness of you and how you're feeling and what's happening with you. So if you're experiencing any stress in the workplace, if you are calling in late all the time or missing work, it's important to seek help. You can talk to someone you trust. Most companies offer as a benefit and what is called an employee assistance program, EAP program. Now, I have heard from some individuals, they're not comfortable because they're not sure if HR is communicating back with the employee assistance program, whoever that provider is who's providing that, if supervisors or managers are privy to that information. It is a confidential service. But again, if you're not comfortable with seeking that service through your employer, you have every right to seek professional support from a therapist or your primary doctor. Also, if you are experiencing these things in the workplace, please know that you have rights. So you have rights under what's called the Americans with Disabilities Act, ADA, to request a reasonable accommodation. And so, again, what is some of the things that you can do? Well, first, I encourage you, and I talked a little bit about having self-awareness. It's very important that we understand our bodies, and what our bodies are telling us. And so it's very important to acknowledge and address the issue, right? Recognize that you're experiencing mental health challenges, but also know that seeking help is not a weakness, it is a strength, right? Consider how your mental health is impacting your work and discuss those potential solutions with a therapist or your treating primary doctor, or if you choose to seek the employee assistance program services through that provider your employer has connected you with, then do that. But definitely seek support. Talk to someone you can trust. But I am going to urge you and encourage you, please, to know who you're talking to, trust that individual or individuals, because your mental health is very confidential, and you just want to be careful with who you are speaking with. Again, you have the company EAP program, but again, you have therapists and your treating providers. And so remember, consider job accommodations, right? Request an accommodation. You may be entitled to a reasonable accommodation under ADA, and there's some law around that, but you can request that within your HR department. Keep your condition private. You have a right to confidentiality. Your employer can't use that to discriminate against you based on your, based on your mental health. Prioritize your self-care. I can't say that enough. Um, if you feel like you need to take a break, um, take a break. And then practice coping strategies. And there's, various interventions out there. There's the mindfulness techniques, there's various breathing exercises, but find a coping strategy that works for you. And then consider, if you need to, consider taking time off, right? One of the things, again, I just want to reiterate is understanding your rights. Again, the ADA, the American Disabilities Act, prohibits discrimination against individuals with mental health conditions. Again, you have the Employee Assistance Program that it really should be a very confidential service provided to you by your employer. They offer mental health counseling and other support services. And then again, understanding that you do have legal protection against discrimination, harassments based on your health conditions. And so here in this particular slide, I just want to share a few resources that you might need or consider. Of course, there's many more resources than I've listed here. You have the National Alliance on Mental Illness that offers information, supports for advocacy. You have the Mental Health Foundation, which is a strong resource in supporting mental health in the workplace. And then you have the EEOC Commission, which is the Equal Employment Opportunities Commission, and it enforces federal laws prohibiting against discrimination. So if you have any questions, I am definitely open to talking further about any mental health issues or workplace mental health concerns that you have. Again, this is just meant to be a brief presentation on workplace and the mental health. You'll see my contact information here. I am more than willing to talk further with you about definitely mental health in the workplace, but other issues as well. I provide services to individuals, couples, and families, and I have been providing therapy services now for over 6 years. So again, thank you for watching the presentation on workplace mental health. Be looking for other presentations that I will share out with you again for educational purposes. Thank you.